Hi and welcome back. Today we are diving into a very important topic that affects most of us or many of us at some point in our lives, and we're talking about appendicitis. Whether you have had an experience with this condition or you know someone who has, understanding this condition is very crucial, and in this video we are going to break down into the causes, the complications, symptoms, and the treatment options for this appendicitis. So let's get started. First of all, what is appendicitis? Well, this is the inflammation of the appendix. And what is appendix, you might ask? Now, this is a small pouch located in the lower right side of your abdomen, and while the exact purpose is not entirely known or clear, it's believed to play a very important role when it comes to the immunity in your gut. It's also believed that it used to be very functional in early man because he used to rely mostly on vegetations. And plants usually have cellulose, which is hard to break down in the digestive system. Now, we have, even in animals right now, we have something that we call caecum, which is the man's version of the appendix, which usually contains some bacteria, and they help in breaking down of this cellulose to provide minerals for those bacteria and also for the animal, so they both benefit. The belief is the early man used the appendix for the same reason. Well, appendicitis usually happens when this pouch become inflamed, and we have several factors that might contribute to you getting this condition, and we are going to look at some of them, one of which is genetical predisposition. Now, some studies suggest that genetics might play a role in increasing the risk of getting this appendicitis. If you have a family history of the condition, your chances of developing it might be a little bit higher than those who doesn't have this in their families. Now, one common cause of this condition is blockage of the appendix, and this is often due to buildup of stool or an infection or maybe a foreign object which is lodged there. When it comes to the foreign objects, you remember we talked about the stubborn cellulose. You swallow a foreign object, it's not digested through the mouth, the stomach, and the intestines. The system thinks that the object qualifies to be digested in the appendix, which is not functional now because it doesn't function anymore. Like we said, it's already a vestigial organ. And what actually happens is it will just go there. One, because of the position of the appendix, it will just go and lodge there. Again, the system knows that anything that's not digestible will be thrown to the appendix, where the bacteria will work on that object and then get maybe the minerals or get the whole thing digested. Now, suppose it's something that's not cellulose, it's something that's a little bit stubborn, so you're not going to digest that. It means that you're going to have that object there blocking your appendix. And when there's no movement of the mucus around that area, then you're going to block off the bacteria that will be there, and you're going to have that overgrowth, and definitely you're going to have that inflammation in that organ. Now, we have the infections like the GIT infections, that is the gastrointestinal infections, which can trigger an inflammation response in the appendix. Suppose maybe around that area where we have the appendix, we have an inflammation, it might overflow into the appendix, and this inflammation can eventually lead to this condition here. We have another cause, which is a lymphoid hyperplasia, and this is an overgrowth of the lymphoid tissue in the appendix, which can obstruct the flow of mucus and lead to the inflammation. And this inflammation is what is causing that appendicitis, because from the name appendicitis, now the end, which is citis, is an indication of the inflammation. Now, the position of the appendix, like we said, makes it to be very prone to the clogging. Now that we have looked at some of the causes of this condition, let's look at the complications that you might get as a result of this condition. Appendicitis can quickly lead to a very serious complication, which is why health providers usually treat this as an emergency. In case you go with this condition, the first priority is to make sure that you attend it to, because this can lead to other complications that will be very, very detrimental to your health. Complications can progress in stages, though they don't actually happen in the same way or in the same sequence. But we have several stages, and look at some of them, one of which is ischemia and necrosis. Now, due to the severe swelling of your appendix or maybe the blocking, the blood supply to that appendix is cut off, which increases the inflammation and eventually causes the tissue to start decaying. Now, this is what we call necrosis. You might also get something we call gangrene or perforation, because once necrosis sets in, the infection can spread, and it may spread slowly through the internal gangrene, or maybe quickly when you have appendix tear, or maybe it bursts, or maybe you get that perforation in your appendix. You might also get abscess. At first, the infection might not spread far beyond your appendix. It might actually form an abscess, which is a pocket of pus on or outside your appendix. This appendix can also develop a mass around itself, and we call this phlegmon. These masses contain the infection, but they can also burst. Due to the position of this appendix to the peritoneal cavity, this is the anal region, you might get this infection spreading to that cavity and likely to get peritonitis. And this infection can also even spread to other organs or even into your bloodstream. And this is what is usually called septicemia, the spread of this infection into your blood. Now, when you get this infection in your bloodstream, it can lead to something that we call sepsis and a septic shock, which is a very fatal condition. And this is the reason why this condition is mostly a medical emergency. Now that you know what appendicitis is, some of the causes and the complications, let's look at some of the symptoms and the possible diagnosis for this condition. Now, remember, if you know or you see someone experiencing these symptoms, it's very important to seek medical attention as soon as possible. One of the signs and symptoms of this condition is hardened poop, what you call appendix stones. This is hard or calcified fecal deposit known as fecalids or appendix stones, and they can get stuck in the opening to your appendix. Now, they carry bacteria, and they can also trap bacteria that are already in that appendix. Now, this usually happens when if they are stuck there, and at times they might go out and they'll be washed off by maybe whatever stool that is going around there, and then taken through your bowel to outside your body. So if you find that maybe you are getting those hard, stony kind of structures that are calcified, there's a possibility that you might be having this appendicitis. Abdominal pain is very common. It's one of the most common symptoms, and you get a sudden sharp pain in the lower right abdomen. This pain might start around your belly button, or what you usually call the navel, and gradually move to the lower right side of your abdomen. You might lose your appetite and have a general decreased interest in eating, along with feeling of nausea and vomiting. When you're fighting this infection, you're going to have symptoms like a fever, chills. Those are classical signs of inflammation in the body, and this is your body trying to fight off an infection that is existing somewhere. Some individuals might experience changes in their bowel habits, such as having diarrhea or maybe even having constipation. Diarrhea might be due to the inflammation from your appendix, which is irritating the end portion of your colon. There are some conditions that you might confuse with this appendicitis, meaning that maybe you have another condition, but it's giving you signs or symptoms that are similar to appendicitis. And there are several, one of which is pelvic inflammatory disease. We have endometriosis, ovarian cysts, we have also kidney stones. Urinary tract infection gives also the same, almost similar signs and symptoms. You have pancreatitis, inflammatory bowel disease, diverticulitis of the colon. We have gastroenteritis, and also even intestinal obstruction. Like, for example, when you have overgrowth of something like Ascaris rubricoides. Let's go to diagnosis. When it comes to diagnosis, a healthcare professional will provide or will perform a physical examination to assess your symptoms and even the areas of your pain. Like we said, the pain in your abdomen, and mostly originating from your navel or your belly button and going to the lower right side of your belly or your abdomen. This might be a classical indication of that infection. Sometimes you might not even have that pain in the navel, but in the lower right side of your abdomen. And that pain is very sharp and it continues being there. So that might be also an indication of you having that infection. Your physician might also order some imaging, like for example, ultrasound, which is an imaging technique that uses sound waves to create a picture of the appendix and the surrounding area. I'm sure you have seen this being done on pregnant ladies when they visit health facilities for their antenatal clinics. This imaging is usually done on them to check on the health of their unborn kids. And this is the same that is used here. The same machine that will be used on them is what will be used on you here. Your doctor might also order a CT scan or a computed tomography scan that can also be ordered to provide detailed cross-sectional images which will aid in diagnosis of this appendicitis. Now, blood tests are not specific to this condition. But we look for the signs of the infection in the body, especially the inflammation. The test includes something like a C-reactive protein. We have full hemogram, which will give the indices of the white blood cells. In case you have an increased amount of this, you might have an infection in your body causing an inflammation. We have something like ESR, which is erythrocyte sedimentation rate, and they can help identify a sign of infection or inflammation in the body, not necessarily appendicitis. So any general condition in your body. So it will be the work of your doctor to narrow down to whatever that is causing that inflammation. Now let's go to the treatments. If you are diagnosed with this appendicitis, you don't need to worry about this because the treatments are very effective and they are available. And one of which is the mainstay is surgery. Surgical removal of this appendix, which is called appendectomy. Now, this involves removing the inflamed appendix to prevent it from rupturing, which can lead to serious complications like we saw earlier. You have two ways this surgery can be done. The first one is a laparoscopic appendectomy. And this is minimally invasive procedure that involves making a small incision and using camera and specialized instruments to remove this appendix. The goal here is still to remove this appendix. The second one is having open appendectomy. So in some cases, you might require having a large incision made to access and even remove the inflamed appendix. And the first thing is to always make sure that this patient is on antibiotics to either to kill the bacteria and also limit the infection or introduction of the infection. So this is one of the procedures that is usually done before you go for the surgery. You get a dose of antibiotics to make sure that there will be no introduction of infection during this surgery, and also to make sure that we kill the bacteria that's causing that inflammation. If you have a very early and mild case of this appendicitis, your healthcare provider might take a wait and watch approach to see if your condition improves with antibiotics alone. You might prefer this approach if you have risk factors that might make surgery less safe for you. Take for example, you have coagulation issues, your blood does not clot as required. However, this is not recommended because at the end of the day, you're going to have appendicitis. Most of the cases, people usually return with a full appendicitis. Even if you started off with a mild one, you took antibiotics, it's going to proceed to appendicitis. So most of the cases are usually reported to come back with a full-blown appendicitis, which is a medical emergency like we saw earlier. Now, after surgery, the recovery period usually varies, but most people can resume their normal activities after a few weeks. But then this will be based on the advice from your doctor. In conclusion, appendicitis might sound doubting, but early recognition and proper medical care, the outcomes are usually generally positive. Remember, if you or someone you know experiences some symptoms like abdominal pain, loss of appetite, fever, or change in bowel habits, always make sure you see or you seek medical attention. And thanks for watching this video. If you have come this far, it means you're gaining value from this channel. Give us a sub and also make sure you ring that bell because I have much more health related contents loading for you. Stay healthy and see you in the next one.